Abled Alert, Outbreak, Emergency, COVID-19 Coronavirus Pandemic. This is the descriptive audio track for the Abled Alert COVID-19 Coronavirus Briefing for the week of April 27th, 2020. Image: global map with red dots signifying the scale of COVID-19 infection in different countries. Total cases confirmed, 3,623,756. Active cases, 2,194,217. Total deaths, 250,977. That's an increase of 3,672 in the past 12 hours. Total critical cases, 49,908. That's a decrease of 143 in the past 12 hours. Total recovered cases, 1,179,596, an increase of 30,766 in the past 12 hours. Image: transparent image of a male torso showing the heart area highlighted and lit up to represent a heart attack. Heart attack or C-19. More image is emerging from around the world that the COVID-19 coronavirus may be damaging the heart as well as the lungs in many patients because it triggers a cytokine storm. We explain what that is below. With every new diagnosis of COVID-19 disease caused by the new SARS-CoV-2 coronavirus, doctors are accumulating more knowledge that raises more troubling questions. One of them is, should every coronavirus patient be tested for high blood levels of troponin to see if the virus has attacked the heart? That's a question New York Times science and medicine reporter Gina Kolata raises in documenting the case of a 64-year-old patient rushed to a Brooklyn hospital with all the signs of a serious heart attack, including high levels of a protein called troponin and an ominous heart rhythm. You can link to the article. Yet, in surgery, doctors didn't find any blocked arteries. They then concluded it wasn't a heart attack. It was coronavirus. Similar cases have been found in China and Italy, documented in the Journal of American Medicine Cardiology, JAMA Cardiology, that you can link to. The resulting question is whether that damage is caused by the virus itself or the body's immune response to it. When bacteria or viruses invade the body, our immune system cells spray the battlefield, so to speak, with cytokines, a family of molecular messengers that have various functions. If the response gets out of control and turns into a flood, the aforementioned cytokine storm, the resulting inflammation and potential for blood clots damages the lungs and the heart. Those cases have found that 20% of COVID-19 patients had some evidence of heart damage. Learn how much higher their risk of death is in our coverage at abled.com. New Abled Alert Module. Airborne C-19 Danger. Image: photograph of the interior of an intensive care unit. Fears that the C-19 virus can be spread through the air have risen after a new study found high levels of it in the air of hospital rooms and traces in corridors hours after patients had left. More details below. A new but small study out of the University of Nebraska says the SARS-CoV-2 virus can spread through the air and remain contagious for hours. Just the frightening scenario health officials have been dreading. During the initial isolation of 13 people confirmed positive with COVID-19 infection, air and surface samples were collected in 11 isolation rooms to examine environmental contamination. Air collectors found high levels of C-19 in the air in hospital rooms hours after patients had left. Just as troubling, they found traces of it in the corridors outside those rooms where medical staff had been coming and going, suggesting that COVID-19 patients, even those who are only mildly ill, may create aerosols of virus and contaminate surfaces that may pose a risk for transmission. This means it's possible people may become infected even if not in the presence of someone who is infected. You can read more at abled.com. Abled is a registered international trademark and wordmark of the Laura N. Wagner Foundation. All rights reserved. COVID-19 related headlines. Image. Abled Health. Photograph of nurses protesting outside a hospital. One carries a sign reading, "Frontline need PPE." Another carries a sign that says, "Bring our nurses back." The PPE crisis. More and more doctors and nurses on the front lines are speaking out about their fears and frustrations of being vulnerable to potentially fatal infection because of the dwindling or non-existent amounts of PPE, personal protective equipment. Some are being reprimanded, suspended, and in some cases, fired for refusing to treat COVID-19 patients if they don't have access to proper PPE, especially N95 respirator masks, which are said to block about 95% of virus particles. The nurses say they are being forced to use surgical masks which won't provide the same level of protection, or nothing at all. And in both cases, there are no guarantees they will prevent viral infection. Much of this is based on guidance from the CDC, the U.S. Centers for Disease Control and Prevention. The Guardian newspaper in London is collaborating with Kaiser Health News on a special series, Lost on the Front Line, as it chronicles the tragic cases of America's healthcare workers who are dying on the front lines. The project aims to document the life of every healthcare worker in America who dies from COVID-19. If you have a colleague or loved one you think they should include, please share their story. There are links within the PDF download or on our website that will take you to those sites. Get Us PPE is a grassroots coalition of volunteers mobilized to address the PPE shortage and get healthcare heroes the protection they need. You can click in the PDF if you need PPE, and also click if you have PPE to donate. Abled Money Module. Image. Photo shows an elderly woman holding a phone to one ear while she holds her credit card in her other hand. Beware of stimulus scams. Ever since the prospect of stimulus checks was raised by the White House and in the U.S. Congress, scammers sprang into action even before the $42.2 trillion package passed the House and Senate. Warnings have gone out from the U.S. Treasury Department, the IRS, the Federal Trade Commission, the Attorney General's Department, the FBI, all the way down to local law enforcement and AARP about the increasing number of stimulus scams. Here are some signs you've got a scammer in hot pursuit of your money. The caller or emailer uses the words stimulus check or stimulus payment. You're asked to sign your check over to the caller. You receive an email, text, or social media message saying that you need to verify your personal and/or banking information to speed up your stimulus payment. The individual offers to get your payment to you faster. You receive a fake check, and then the sender tells you to call a number to verify your personal information in order to cash it. Ignore online offers for vaccinations and home test kits. There are no products proven to treat or prevent COVID-19 at this time. Hang up on robocalls. Scammers use them to pitch low-priced health insurance and other schemes. You can read more of these signs at abled.com. Abled is a registered international trademark and wordmark of the Laura N. Wagner Foundation. All rights reserved. More COVID-19 related headlines. Abled People Module. Image. Photograph of country music icon Dolly Parton holding a children's book as she wears reading glasses. Good Night with Dolly. Music legend Dolly Parton is hoping to provide comfort and reassurance to kids and families during the shelter-in-place mandates during the COVID-19 pandemic. How? By launching a weekly series in which she reads a children's book to an online audience at bedtime. Good Night with Dolly will be streamed on YouTube and elsewhere starting every Thursday at 7 p.m. Eastern Daylight Time. The musician and philanthropist, known better as the Book Lady to most youngsters, will be reading books from her Imagination Library project, and the first book in this series is The Little Engine That Could by Watty Piper. The Dolly Parton Foundation's Imagination Library has delivered more than 130 million free books to children since it began in Tennessee in 1995, earning special recognition from the Library of Congress. Dolly has also pledged $1 million to coronavirus research being done at Vanderbilt University in Nashville. That's the same amount she gifted to the Monroe Carroll Jr. Children's Hospital at Vanderbilt in gratitude for the cancer care her niece received there over 2 decades ago. There are links within the downloadable PDF or on our website that will take you to the sites that are highlighted. Abled Travel Module. Image. Photo of a sign that says reception with 2 people in the background at a reception desk inside a hotel. No hotel refunds in the Netherlands. Holiday travelers in many countries are getting stuck between a rock and hotels because of the C-19 pandemic. If you are stuck at home because of a government-mandated quarantine, what are your chances of getting your money back from a hotel or holiday park where you've made an advance booking? That's an issue travelers, consumer groups, and lawyers are wrestling with, and the relevant legal questions in the Netherlands where some businesses are seeing 95% cancellations. The outcome depends on who is doing the canceling. If a hotel or holiday park cancels your stay, then you do have the right to your money back. If the consumer is canceling, then the terms of the booking are key. DutchNews.nl spoke with lawyer Martijn Zwenes of Spouwstraat 10 Advocaten in Amsterdam, who says, quote, "If you are canceling, then it is your problem. The hotel is still there and it has the room. But we recommend that you do see if both parties can come up with a solution in a reasonable manner, because this is an exceptional situation," end quote. He adds that if you made a non-changeable booking and want to claim on your travel insurance, you might also be unlucky. Many travel insurance policies will not cover the coronavirus lockdown because it is such an extreme event. Needless to say, this is making consumers very angry and frustrated. Sinead Bozias has done a great article on the challenges facing both consumers and businesses on this front at DutchNews.nl. You can link to it within the downloadable PDF or on our website. You could read more about these travel issues at able.com. All information in this briefing is presented for informational purposes only and is not a substitute for advice from a doctor or other medical professionals. All materials are copyright 2020, able.com and their respective owners. Thank you for listening. We hope you found this helpful.